County, California is sort of easy to spot on the map. You can see it down there at the south end of your screen, next to San Diego, just above the border with Mexico. Imperial County, California, about 85% of its residents are Hispanic. Imperial County is also poor. 22% of the residents there live in poverty. A lot of the households in Imperial are multi-member households, meaning more so than on average. You've got a lot of people living under one roof. And all those things taken together, we know, can be factors that can make a sort of perfect storm in terms of COVID. And indeed, Imperial County has been hit incredibly hard. Thus far, 1 out of every 7 residents of Imperial County, California, has tested positive for COVID. 1 out of every 7 people in the county. That's more than double the rate of, say, New York City. At the beginning of the summer, Imperial County had the dubious distinction of having the single highest rate of infection in California, which is really saying something at the time, because at that time, California was very much the eye of the storm for the whole country. It was the worst place in the worst place. In Imperial County, you might remember our coverage of the Centro Medical Center, which was so overwhelmed by hospitalizations due to COVID that new patients were being transferred to hospitals hundreds of miles away, all the way up to Northern California or other states. The director of the emergency department there likening it to a scene out of Apocalypse Now, with helicopters airlifting patients out of there every few minutes, quote, like it's Vietnam, she said. Well, that was June. 8 months later, Imperial County has new problems. Vaccines, for one. Mainly, they don't have enough vaccines to meet demand. So we've seen scenes of senior citizens in Imperial County standing in very long lines, many of them ultimately being turned away. But even with all the challenges, the difficulty in getting enough vaccines to a place like this, the incredible numbers of infections and hospitalizations and deaths and all of that suffering and all of the strain on the healthcare providers who have coped with all of it, even with all of that and all they have been through, this is important. Imperial County, California is also emerging as a national leader, as a success story of a kind. Because in Imperial County, they are proving that if you can get people high-quality advanced treatment early on in the progression of the disease, you can keep people out of the hospital in substantial numbers. We're talking about the kind of treatment that Dr. David Kessler, who's the chief science officer for the COVID-19 response nationally under President Biden, these treatments that he was just talking about being severely underused, treatments that can reduce hospitalization rates by 50, 60, 70%, that have been shown to be very effective when they're given to people in the first 10 days in which they're symptomatic. Not people who are very, very sick and already in the hospital, already needing to be put on a ventilator or some sort of serious treatment like that, but people who have mild or moderate symptoms. First 10 days that they are feeling ill after being diagnosed with COVID, people treated with monoclonal antibodies at that point in their disease progression can, in very large numbers, be prevented from ever being hospitalized and ultimately from dying. We don't have a cure for COVID, but these monoclonal antibody treatments, which get administered to people through infusions, like a blood transfusion or like chemotherapy, these monoclonal antibody treatments, 3 of which have been approved for emergency use by the FDA, there are hundreds of thousands of doses of them available around the country. More than almost 70% of them have thus far gone unused. But in Imperial County, California, in this place that has had such challenges, where the population has been so affected by COVID, where people are largely from underserved communities, where there are language barriers, where there are multi-generational households, where there are very high rates of poverty, where there are so many other healthcare challenges, these treatments that have largely been seen as sort of just the province of the rich and famous and well-connected have actually been very effective for even this poor, underserved population. The largest hospital in Imperial County, Centro Regional Medical Center, has started infusing monoclonal antibodies into people who are at high risk of progressing to severe COVID disease. They give these infusions early in the course of infection, before anybody has to go to the hospital. And according to the CEO of the hospital at El Centro, over 500 of their patients have received monoclonal antibody treatment. Half of those patients have avoided hospitalization, which is a significant decrease from the rates they were otherwise seeing. And so we look to these places in the country that are hardest hit, that have the most factors cutting against them in terms of how badly they have been affected by COVID. And you see there emerge among them and emerge from those places leadership, showing some of the best off places in the country how much better they can do at keeping people with mild COVID from getting sick and ultimately dying. Imperial County, California, one of the hardest hit places on the entire map in our country, is showing that these treatments work if you can get them to people and if you can get them to people in time. Joining us now is Dr. Adolphe Edward. He is the Chief Executive Officer for El Centro Regional Medical Center in Southern California. Dr. Edward, it's a real honor to have you here tonight. Thank you so much.
Thank you, Rachel. It's great to be with you. I look forward to the conversation.
So we have talked a little bit about Imperial County and indeed about El Centro over the past few months as we've watched the course of the pandemic. And we know you and your colleagues have been taking care of so many people. It's been so hard hit. Let me just ask if the way I just explained it, if I said any of that wrong, or if I put the emphasis in any of the wrong place.
No, absolutely. You said it very well. Our community really has been devastated by the COVID pandemic, and we're using every tool in the toolbox that we have to be able to get through the day and make sure that our community is served.
These monoclonal antibody treatments, their public profile, I think, is small because monoclonal antibody treatment is hard to say, let alone the drug names for any of these drugs, which are absolutely unpronounceable. To the extent that they've got any public profile at all, it's a sense that they're a drug just for rich and well-connected people. President Trump was able to get some. There's been some reporting about the White House having some doses and Jared Kushner hooking up people with getting. It seemed like this sort of inaccessible treatment that you had to really be somebody in order to get. You've absolutely proved that wrong with the sort of what sounds like considerable success you've had administering these to a lot of people, to hundreds of patients at your facility.
Well, we're very thankful for the support that we really received from the HHS and the team, Dr. Cadillac, Dr. Michael Anderson and others, Gina Smith. By bringing the team down here, we were already starting to use some of these medications to treat our COVID positive. But to add those teams to our existing clinical teams who are brilliant and worked really hard to take care of this community, we were able to bring what I used to call bringing in the president's actual treatment down here to us, the local common community that's hit hardest. So we're very thankful to have had the support that we got from the state as well as from the federal government to be able to bring this treatment. And it's really not a good deal to have 70% of that treatment sitting unused, but using it for our own population has become a godsend.
Has it been resource intensive to do it? Is there cost to patients? I know that you have to administer these drugs as an infusion, which means people have to, it's not like just getting a shot. You have to sit there for an hour or so and be very patient while the drug is infused to you. Has it been an expensive thing for your hospital to take on at the scale that you've been doing it?
No, not at all. And I actually encourage my fellow CEOs across the country to actually open up their minds and their infusion centers quickly to care for their own community. I think today we've got to use every tool that we have because vaccines have been hard to come by down here in Imperial County. Having the monoclonal antibody has helped. What we've done is that we've used our vaccination drives, to pass the word out to patients. And believe it or not, we're getting referrals from people that would take that information, pass it out to their family member. We have one person who brought in 6 members of their own community after celebrating New Year, all COVID positive, all received the treatment, all now have a life to look forward to. So it has made a huge impact in our community.
Dr. Adolphe Edward, Chief Executive Officer for El Centro Regional Medical Center in Southern California. Thank you for your time tonight for helping us understand this. I think this is a really undercovered, underappreciated, bright light, a real possibility in the sort of COVID darkness. Thanks for your leadership. Thanks for helping us understand.
Thank you so much, Rachel.
All right. Much more ahead here tonight. Stay with us.